Colorectal cancer is a disease which we have typically thought about in patients who are older. However, recently we've been seeing an increase in patients who are younger than 50 being diagnosed with this disease. If caught early, colorectal cancer can be a curable cancer. Colorectal cancer is cancers that affect the colon and the rectum. The colon and the rectum are the last parts of the digestive system. The presenting symptoms of colon cancer are things like rectal bleeding, a change in bowel habits, and that can be more constipation or more diarrhea, abdominal pain, changes in appetite, and weight loss. It's hard to always figure out if these symptoms are related to a cancer, but the key would be, if you have these symptoms, talk with your doctor.
I came to Duke when I was 43 when I was diagnosed with colorectal cancer. Over the prior year, I had noticed very mild bleeding when I would go to the bathroom. I chalked it off to getting older. When I was on a business trip in Europe, however, I had a major bloody stool movement, and at that point I knew this was much more serious. I immediately contacted my Duke primary care doctor, who referred me to the Duke GI Center, who prescribed a colonoscopy, and it was at that point that I knew I had potentially had colorectal cancer.
We use mammograms for the detection of early breast cancers, and similarly, we can use colonoscopies for the detection of early colorectal cancers. A gastroenterologist during that procedure may find precancerous polyps and would remove them, and that's one of the best effective tools that we have to prevent colon cancer developing, is to remove those precancerous lesions, or even sometimes remove cancerous lesions during the procedure itself. If a colorectal cancer is detected at the time of a colonoscopy, you would then be referred to a multidisciplinary team that could involve a colorectal surgeon, a medical oncologist, and a radiation oncologist. That team would work together to figure out the best treatment plan for you.
When I met with my oncology team for the first time, I was asking a lot of questions. They took the time to answer all of the questions that I had, probably more than once in every single meeting early on, and that again gave me assurance that I was getting the best care, the best information that I could.
We don't really know why we are seeing an increase in colorectal cancer in patients younger than 50. Some of the rise has been attributed to dietary factors, to not being very active and leading a very sedentary lifestyle, to smoking, to drinking. In addition to these risk factors, we also know that race plays a role. Black Americans have a higher rate of being diagnosed with colorectal cancer and dying from colorectal cancer. A family history of colorectal cancer can increase your risk of developing colorectal cancer, but it's so important to point out that even without a family history, if you have symptoms, that you should seek out the care of your doctor and likely get a colonoscopy to screen for colon cancer.
When I had my follow-on doctor's visit in January of 2018, I was told there was no cancer actively present in my body. It's not an easy journey, but with good information and a clear understanding of your diagnosis and the treatment plan, you can kind of look the problem straight in the face and with confidence progress through the process.
Colorectal cancer is preventable. It is often treatable, especially if caught early, and we can help you.